Hi everybody, this is Dr. Sham. I'm a rheumatologist practicing in Chennai. So what are some simple tips for living with RA? Most important thing is identifying it early. That eases out our most of the issues. So the most important thing. Second thing is proper treatment in the initial 2 to 3 years. Be under regular follow-up with a rheumatologist, and also keep your family physician in the loop. Then regular monitoring with blood test and cross consultation. So monitoring with blood test, as I told, for two things. One is to assess the disease activity. The second thing is to make sure we are not having any side effects due to the medications. Cross consultations, there are sometimes, as I told, rheumatoid arthritis is not just about the joints. It can involve the other organs. Particularly patients, we many times send it for a eye checkup because they can have inflammation in the eye. Or patients on hydroxychloroquine, ask them to monitor for toxicity. Or sometimes if you have any lung involvement, we refer to pulmonologist or a dermatologist if any skin involvement. So definitely cross consultation. It's not just the rheumatologist. They will be in the center. They will be depending on whichever system is involved, the other specialist or the physicians will be roped in. Then most important thing is regular intake of DMARDs. Remember, these tablets take 3 months for it to start acting. Even after 5 years, if you stop the tablets for 2 weeks, again it has to be restarted from the beginning. Means again it will take 3 months. Every time you are going to take it irregularly or break it, unlike other tablets which you don't take it today, tomorrow you take it immediately, it acts. But these DMARDs, once we give a gap of a week or 2 weeks, every time the blood level goes down, again to rebuild it, we need a period of 3 months. And in those times, we have to unnecessarily be taking a painkiller or steroid, because you stop it, pain comes back, the tablet doesn't act immediately, you have to wait for 3 months. If the pain is bad, unnecessarily we have to take a painkiller or steroid. So as I told, main thing is always discuss with your doctor or understand it has to be taken continuously for at least 12 weeks to start acting. Some tablets even take a little bit more term. Till then, you might be needing the help of a painkiller or steroid. Then those painkiller or steroids have to be tapered and stopped. There is no second opinion about it. So patient education is very important. Means you have to discuss with your doctor. Another important thing many times which is neglected, I have not mentioned here, is about the mental well-being of the patient. So there can be other stress factors. Many patients with rheumatoid, due to the pain, they can be depressed. These also have to be addressed. We do try to discuss with the patient. Sometimes when some people really need the help of a psychologist or psychiatrist, please don't get offended. Doing that might help out actually more, not just taking the rheumatoid medications. So this is something which we are not concentrating much or not talked about openly in our India particularly. So mental health being is very, very important. We should know the background, the patient's familial conditions, both economy and other things. This is all equally important. The most important thing neglected is many times. So even I don't like. It's not that all of us are fitness freaks. Many of us don't like to exercise. But once you get an arthritis, definitely doing a regular exercise or yoga helps in a big way. Definitely, it brings down the pain. Maybe you can even come down on the dosage of your tablets. So always, it's a wholesome approach. As I told, one is regular intake of tablets, doing regular exercise, yoga. A proper diet is equally important. Many times I hear, what if you take milk, you put on weight. So see, please, calcium rich products have to be taken. The most common thing is milk products, whether it's a milk, curd or buttermilk or whatever. Other things you do find it in spinach and other things. So we need a diet rich in calcium. Even if your doctor is giving you a calcium tablet, remember two things. One, people think that it might cause toxicity and stone. It can never happen, because the tablet will have only 20% of your daily requirements. So even if your doctor gives a pill of calcium, still you have to take around 70 to 80% of calcium from your diet. Remember that. So it can never be over treated with calcium, provided you are given the right form of calcium. Other important thing is sunlight. See, I think I need not overemphasize on that. We all know sunlight is needed, not just for vitamin D, even otherwise sunlight is good for our health. So exercising, doing yoga, taking a diet rich in calcium, being positive, being in a positive frame of mind, going out in the sunlight, definitely people who are approaching this positively, they do very well. Surprisingly, there are some patients, you won't believe, even by doing these things regularly, they have been almost able to drastically come down. Patients were really bad, they were able to come off the steroids, painkillers, even the dosages. They have come. One patient literally stopped all the tablets as in drug-free remission. Uh, Definitely, it can work magic. Many times we think tablets do more good. It's not like that. Everything has a role, so it's going to be a wholesome approach to definitely exercise or yoga, whichever you are for it. Like, it depends on your individual thing, or even an aquatic exercise like a swimming, and a proper diet, all these things definitely makes a big difference in management of RA. Thank you.